Good morning. My name is Adil Shamji. I'm the Member of Provincial Parliament for Don Valley East. I'm here with the interim leader of the Liberal Party, John Fraser, this morning. I also happen to be an emergency physician who has worked at the front lines of the opioid crisis and COVID-19 for most of the pandemic. 3 weeks ago, Mr. Fraser and I stood here and called upon Doug Ford to work as hard as healthcare workers. We warned that the system was overwhelmed and at risk of collapse. Following that statement, there was no action or mention taken by Doug Ford or Sylvia Jones, which to me is a tacit acknowledgement of the fact that they are satisfied with the status quo. In fact, the very next day on July 13th, the Chief Medical Officer of Health, Dr. Kieran Moore, sat exactly where I am standing and provided his assessment of the healthcare system during his press conference, and he reported that the healthcare system is still operating at a, and I quote, very high functioning level. If it was operating at a very high functioning level, we wouldn't be here today. Consider, in the month of July, there were at least 13 closures of emergency departments across the province in both urban and rural areas. And I am talking about 13 different emergency departments, not 13 days of closures. I'm not talking about other acute care units. I'm talking about emergency departments. Can you imagine the incalculable suffering when someone in dire straits, in the throes of a medical emergency, cannot even turn to their local hospital for emergency medical assistance? And that is just the tip of the iceberg. This weekend alone, it has been reported that there are at least 20 closures of acute care units across our province. This includes high acuity clinical services, such as obstetrical units and intensive care units, as we have seen in Bowmanville. On a weekly basis, there are thousands of healthcare workers who are not able to come to work because of COVID-19, because of burnout, because of lack of supports. ER wait times are at an all-time high. And for every emergency department closure that I have referenced, there have been countless other close calls that have only been averted by absolutely heroic measures, like asking nursing students or physicians to fill in for nursing roles. And so does that sound like a very high-functioning healthcare system? The writing has been on the wall. Only this winter, we were seeing code oranges when hospitals declared disaster situations because they didn't have staff. And paramedic services were calling code zeros because they didn't have ambulances available to respond to 911 calls. Then, as now, there has been zero leadership. Not a single word from Premier Ford or Minister Jones, despite repeated calls for action. Truthfully, I am perplexed that not even the closure of the emergency department in Minister Jones's own riding has compelled her to say any single word or take any action whatsoever. I have not been able to get a single response from Minister Jones, despite multiple emails, and even last week resorting to sending a letter in the mail. Premier Ford and Minister Jones need to come out of the action, and they need to demonstrate leadership. In short, they are our cabinet. They are the executive council. And so it's time to start executing and delivering results for our healthcare system in Ontario. Now, I would like to speak directly to Minister Jones and Premier Ford. As an emergency physician and a frontline healthcare worker, on behalf of my friends and colleagues, it has been the privilege of a lifetime to serve the public during this pandemic. But paramedics, nurses, doctors, and allied healthcare workers are being pushed to the breaking point and beyond because your inaction is making our jobs actively and predictably more difficult. Speaking as an MPP and your colleague from across the aisle, I understand that the situation we are in is not easy, but it's the job you signed up for. You told Ontario that you would get it done, and now we're waiting. As your colleague, I am here to help. We are here to help. I urge you to show the same courage that our healthcare workers are demonstrating and show up to fight for Ontario's patients. We need you to be accountable. We need you to provide a frank assessment of the situation and we need you to stop any further deterioration of our healthcare system. We are urging the Ford government to do a few things, including prioritize the recruitment and retention of healthcare workers by repealing Bill 124 and increasing mental health supports. We urge you to accelerate the credentialing of foreign-trained healthcare workers, provide 10 paid sick days, and make sure that hospitals are doing the things that only hospitals can do by increasing supports to primary care clinics, community clinics, and long-term care facilities. However, I could offer much more advice, but a prerequisite to all of this is that you simply need to show up. And with that, I'd like to turn that to my colleague, John Fraser.
Thank you. Merci, Adil. For months now, Ontario's nurses, doctors, and frontline healthcare workers have been alerting the Ford government to the crisis that we are now experiencing in our hospitals. Depuis des mois, les infirmières, les médecins et les travailleurs en première ligne de l'Ontario alertent le gouvernement Ford sur la crise qui sévit cet été dans nos hôpitaux. More than a dozen emergency rooms in this province closed in July, and the number continues to rise. This past week, the ICU at the Bowmanville Hospital was closed, and patients were transferred out. The situation is very serious. La situation est très grave. The problem is, we don't have enough people to provide the care that people need. Nurses are leaving the profession at twice the normal rate. Twice the normal rate. And it's not slowing down. Tout au long de cette crise, le Premier ministre et le ministre de la Santé ont été absents et silencieux. Through this crisis, the Premier and the Minister of Health have been absent and silent. Frontline healthcare workers the Premier cheered on as heroes can't get the time of day from him or his minister. The message the Premier and the Minister is sending to the front lines, to patients and their families is, we don't care. It's not a big deal. You're on your own. Nurses are showing up. Doctors are showing up. Paramedics are showing up. All across the system, the people who care for the people we care for most are showing up. Why is it the Minister and Premier Ford can't show up? When times are tough, people need to see their leaders. Lorsque les temps sont difficiles, les gens ont besoin de voir et d'entendre leur leader. We all know this situation is not easy. La solution ne sont pas faciles. There are measures the government should have taken by now. Repeal Bill 124. Add more mental health supports. 10 paid sick days for all Ontario workers. And accelerate the credentials of the tens of thousands of people who have medical training in this province but can't use it. I know the Premier and his Minister have talked a lot about immigration. That's good. That's important. That's a good fight to fight. But if we can't actually get them the credentials when they're here, and we have tens and thousands of them right now, how attractive is that going to be for people who are working somewhere else if they know they're going to wait months or years to be able to use their credentials? I think that's particularly important. And we need more resources for primary care. But above all, the first step, is for the Premier and the Minister to show up and speak directly to frontline workers, patients, and their families, and address the situation. Thank you. Merci. We'll take your questions.
John, we've seen COVID cause staff shortages in all sorts of industries. Travelers see it every day at Pearson Airport. You want the health minister to show up and say what? I mean, paid sick days aren't going to fix the issues at hospitals, are they? Getting rid of a wage cap is going to fix the issue, isn't it?
Well, here's the thing. We have a crisis in front of us right now. Right? We know it's not easy. Bill 124, it's not something that happened last week. It's been hanging out for 2 years. And it's a big reason why nurses are leaving the profession at twice the rate. What do we need in our ERs? What do we need in our hospitals? We need nurses. We need doctors. How do you get them? First of all, you treat them right. You treat them with respect. That's number one. First thing a minister should do is walk out here this afternoon and say, I'm going to be repealing Bill 124. It'll make a big difference. Just ask nurses. Don't ask me. Ask nurses.
Backwards looking, though, isn't it? What do you do today to fix the
That's
staff?
what you have to do today. You got to stem the tide.
You agree with that, Doctor?
Yeah, come on, doctor. Yeah, come on.
And you're going to say that all the nurses that you contend have left because of that bill are going to come back tomorrow?
No, I think it's reductionist to say that Bill 124 alone will solve this problem. We've outlined today and 3 weeks ago a number of steps that need to be taken collectively. Our healthcare, the Ford government does not have a health human resource strategy whatsoever. In the last bill that they published, it was preoccupied and infatuated with infrastructure. But we need to value the backbone of our healthcare system, and that is healthcare workers. That means paying them right, but that's not the only thing. We need to fight for them to have mental health supports. We need to make sure that every person who's able to contribute in our healthcare system is empowered to contribute. That's why we're calling for the accelerated credentialing of foreign trained healthcare workers. There's no one single solution, and that's not what we're calling for. We're calling for Doug Ford and Minister Jones, number one, to show up, provide a frank assessment of the healthcare system. There's no one in this room, I believe, that thinks that we have a very high-functioning healthcare system right now. So let's start by acknowledging that. And then let's talk about all of the solutions at our disposal, which does definitely include repealing Bill 124. And let's bring all of them to the table and show some operational day-to-day leadership and accountability.
John, what did you make of the health minister showing up to that golf fundraiser the other day?
It's sending the wrong message to frontline healthcare workers. And sorry if I got a bit worked up there before, because I am really quite frustrated with the government's inability, the minister's inability. I mean, she can show up at a golf tournament, but she can't show up here and say to healthcare workers, I know that you're under a lot of pressure. I know that you're suffering. I know that you're there for the people who we care for. And here's what we're going to do. No one's saying that the solutions are easy or it's going to fix things tomorrow, but you got to start fixing them. Bill 124, plug the hole in the boat. Slow down the retirement of nurses. Slow down those people leaving. I mean, who's going to want to come here and practice as a nurse if their wages are frozen? So that was what my point was there. And the minister's just got to show up. I'll say this. Here's what it reminded me on the weekend. I'm from Ottawa. And in February, there were terrible things happening in Ottawa. They called it the occupation of Ottawa. What was happening to the center of our city was wrong. And this government, the same minister and the same premier, did exactly the same thing. They didn't respond. They didn't stand up. They didn't take action. It was a crisis. It was serious. No, it wasn't affecting all of Ontario, just like ER closures aren't affecting every person in Ontario at this moment. But it did affect the people of the center of Ottawa and Ottawa. And right now, what's happening in the ERs, what's happening in our hospitals, is affecting some people very, very seriously. No, it's not all of us, but it could be us. Could be each and every one of us. And that's why the minister needs to show up. If you're a leader, you need to show up. Face the tough questions. It's wrong. It doesn't make any sense what she's doing. And it's sending the wrong message. The message that she's sending, you're on your own. I'm your leader, but you're on your own. Fix it yourself. You can deal with it. Not what people need to hear.
John, I was watching on CBC this morning. They're having the same problems all across Canada, particularly Newfoundland, Atlantic provinces, which they highlighted this morning. So this is a countrywide problem. It's going on in other countries. What else do you think needs to be done? I mean, everyone's competing for the same pool of shrinking workers, it seems.
Yeah. Well, if you're making it unattractive for them to come and work here, because if they work in our publicly funded healthcare system, they can only get 1%, eliminating that would be a good start. Right? Having a health minister that responds to crisis in the healthcare system would be a good start. I know this is happening all over the world, but it's not an excuse for people to wash their hands of it. And that's what it feels like the minister's doing. just simply washing her hands of it. You know, I'm going to turn this over to Dylan in a second, but I read, a statement from the minister last week that the government was working proactively with partners. So I think I might send a dictionary over to the Ministry of Health, to the minister, and maybe the Premier's office. Proactive actually means you take action in anticipation of something happening. And that's not how I would describe what's happened with this minister. It feels more like procrastinating.
Thank you for that astute point. And quite frankly, I agree with you. Ontario is not the only jurisdiction that is having these troubles. And that's why in my remarks, I said we're not in an easy situation. But just because it's a difficult situation doesn't mean that we have to abdicate leadership. It doesn't mean that we have to accept the present circumstances and not move a single inch to try and improve those circumstances. When our leaders don't show up, they can't tell us how our healthcare system is operating, won't take a single step to improve any of those things, that differentiates us from those other jurisdictions. Yes, we all have those problems, but we're not doing anything about it, and that's what we're calling for.
Right, thanks. I just wanted to add,
Of course,
are
sir.
you continuing to practice a little bit? I guess you have to keep your license up anyway. But
Yeah. So presently, I'm on a leave of absence, and the reason for that is I've never been fully involved in politics before. Stepping forward was a dramatic change in my career, and so right now I'm focused on learning what it means to be a member of provincial parliament, learning what it means to sit in the legislature, and focusing on being the best champion for my community and the people of Ontario that I can be. And then once I feel as though I can execute my tasks as an MPP, I will absolutely be resuming and reintroducing my clinical activities.
Doctor, do you think it's the case that we're seeing absenteeism among healthcare professionals because they're coming down with COVID? And if so, do you think we need any new restrictions on that front?
So certainly COVID absences are taking place because many of our healthcare workers are contracting COVID-19. Certainly, I think we need to engage in far more health promotion strategies. And what I mean by that is we need to make sure that every person in Ontario understands what their risk is, understands what steps they need to take. For example, whether they should or should not be going forward to get a fourth booster dose. I think many people walked out of the conference in this room just a few weeks ago, still confused about whether they should be going to get a booster dose. And many of us don't have any, I certainly, as someone in the know, as a healthcare professional, still don't know what the plan is this fall for whether we're going to be doing booster doses, whether we will have a bivalent vaccine, and what the rollout strategy for that will be. We've known that vaccinations for kids, between 6 months and 5 years, we've known that it's been coming, yet there hasn't been any sort of organized plan to roll that out. And so do I think that we need more health promotion measures, by which I mean educating the public, helping them make the right decisions for themselves? Absolutely. And I would leave it at that.
John, Ontario has always been experiencing a healthcare crisis. Healthcare problem, in terms of staffing shortages, in terms of long wait times. Prior to the PCs coming into power, the Liberals held power for the last 15 years. And even the term holy medicine was popular when the Liberals were in power. Don't the Liberals bear some responsibility as well in terms of the healthcare crisis we're experiencing right now?
Well, there are things that obviously, the challenge is, could you have done more? And I'll accept that. I do know in this, in our government, we were the first government to measure wait times in ERs for cancer surgeries, for ophthalmic surgeries, for hips and knees. So there was a lot of progress made in our healthcare system. You have to remember, when we took over in 2003, 26 hospitals had been closed by the previous government. I think we opened 26, and there were, more than 100 other major infrastructure projects at hospitals. So look, there's more that we could have done. Yeah, every government can say that. But I think what we have right now is a particular situation where you've had a government that's created a problem in healthcare human resources with Bill 124. It's been hanging out for 2 years. They've been told it's a problem, not just by politicians in the legislature, but by nurses, by other allied healthcare professionals. And quite frankly, it's not about the money, just about the money. It's about respect. What they're saying to nurses is, you can't bargain. You're not allowed to bargain. But, if you were a firefighter or a policeman, you can bargain. How do you think nurses view that? Right now, that's, I would say, a barrier to having an effective healthcare human resource strategy. How are we going to attract people to come to this province if that's what the government's wage policy is? How are we going to invite people to work in our publicly funded healthcare system if the government's going to treat people like that? That's the problem.
And you also mentioned that you said that the Minister of Health is procrastinating. Is there a scenario in your mind where the government might actually act if it gets even worse? Is there a particular scenario that you're waiting for the government to act on?
We keep hearing that the government's going to act on Bill 124, but it's been going on for years, for a couple of years. 10 paid sick days, we've been talking about that. Foreign trained healthcare professionals. What are we doing to actually accelerate the credentialing of people who work here? Or have them work under supervision, or find them some way to contribute to our healthcare system in this situation? There's no sense of urgency.
You brought up the Chief Medical Officer of Health. Do you think he should also be out addressing this?
Well, it's obviously a public health problem. I'll turn that over to Adil, but I think Adil's remarks with regards to, saying our system was highly functioning. Certainly it's functioning well for some people, but for too many people, it's not functioning nearly well enough. I'll just turn it over to Adil.
Thanks, John. No, I certainly agree with that. This is a healthcare crisis. It is a public health crisis, and so it would be incumbent upon the Chief Medical Officer of Health to come before us, along with Minister Jones and Premier Ford, to speak to the problem, speak to the necessary solutions, and help us execute a solution.
John, do you know when the Liberal convention's going to be, and are you going to run for leader, John? Or what's going on there?
No and no. How's that for an answer? No, we're actually going to get together on September the 10th and come together as a party to Provincial Council and talk about the election, talk about what we have to do to go forward. And quite frankly, tomorrow they'll have to be ratified by the party tomorrow, hoping that happens. And so we're right now there's two things that are really important that are in front of us. And number one is being an effective opposition and pushing the government to do the right thing, to provide solutions for them as well, too, not just to criticize. We're not here just to criticize. We're here to provide solutions. I think we've done that. And the second thing is we need to start getting ready for the next election. That's what the party has to do. And that's what we'll be talking about. We'll have an AGM later this year. Maybe we'll talk about how the new leadership, we'll probably talk about how the leadership process will work. And
are you planning to run for leader, Doctor?
I just finished telling the gentleman over there that I'm still learning what it takes to be a member of provincial parliament. I haven't even sat in the legislature officially for a single day, so I think it's an extremely premature question. I'm just here to serve our province.
Ladies and gentlemen on the phone, as a reminder, if you have a question, please press star 1. Your first question comes from Jack Hahn with Queen's Park Briefing. Please go ahead.
Hi there. Hi, John. Just confirming what I think I heard you say is that you're not interested in the OLP leadership?
Linda and I had a long conversation about it, or a few long conversations about it. And, we've got 3 grandchildren. I want to, the most important thing to me is to have a friendship with them as they grow up and get into adolescence. And, I want to work hard. I'm going to work hard for this party. I'm going to work hard for my constituents. But I want to have enough time to have that friendship, because I think it's really important in their lives. It's certainly important in my life.
Okay. And you said you're hoping to be ratified tomorrow as the interim leader, though?
I think there's an executive vote tomorrow at 5:30, and I'm hoping Adil will vote for me.
Okay. All right. That's all my questions.
Great. Thanks a lot.
No more questions.
Great. Wait.
If government handling is a factor, what would you want to tell voters? I think it was an 18%, was it? Gave the government a majority?
Well, look, the thing is the government earned a mandate. And we can talk about the election, what happened there. The reality is they earned a mandate. Whether 60% of the people voted or 43% of them, that's the situation that we're in right now. The government has to execute that mandate. And right now, they're not with regards to healthcare and our emergency room closures. And what I can say to the people of Ontario is Ontario Liberals are going to continue to do what we did in the last session and what we did in the years before. We're going to fight for the healthcare, the things that matter most to people, their schools, their hospitals, taking care of the most vulnerable. We're at where we're at. And that's our commitment to them. That's what I could say. Thank you.